How to start a Revi therapy session. To place the Revi wearable, wrap the leg band around the ankle, then ensure the unit is powered on. Before tightening the leg band, align the blue markings of the antenna with the implant scar. Fast beeping sounds and the LED blinking light will signal when the wearable is correctly positioned over the implant. Tighten the strap to secure comfortably, and then press the power button. The LED light will blink as the stimulation therapy begins to ramp up. Once the system reaches its pre-programmed setting, the light will become steady, indicating the program level has been achieved. If necessary, you may adjust the stimulation by pressing the plus symbol to make it stronger. You can decrease stimulation by pressing the minus symbol. When pressing the plus or minus button, you will hear a beep and the LED will blink once. If further changes are needed to your stimulation therapy, you may repeat these steps. Once your therapy session is complete, the Revi wearable will turn off automatically. However, if you need to stop your session, simply press and hold the power button or remove your Revi wearable. Connect your wearable to the charger until you are ready for your next therapy session.